Everyone, thank you for joining us again for Public Health 101. Today we'll be hearing a presentation from the Center for Healthy Homes and Environment. So if you would like to introduce yourselves and your roles, we can get started.
Okay, thank you, Jen. I'm Mike Simoli. I'm the Chief of the Center for Healthy Homes and Environment here at the Department of Health. We're in the Division of Environmental Health, room 206 on the second floor of the Cannon Building. Actually, I'll let each of the program managers introduce themselves as they present their section. We've divided this presentation up into approximately 6 divisions within our own center, and having each program manager present his or her own for approximately 7 minutes apiece. I'd like to hold questions till the end because we do have quite a few slides to get through, and each of the program managers is on a time schedule during this presentation. Our center is both a regulatory and a health promotion center. We do both. We also offer technical assistance to licensed professionals. We have about 20 employees when we're fully staffed. We cover lead, asbestos, and radon, all of which are covered in Rhode Island statute. Toxicology and health risk assessment. We have an Osha program, Osha consultation to assist, small employers with becoming compliant with safety standards. We have a climate resiliency and change program that focuses on helping the population adapt to severe climate conditions. And we have an environmental health tracking network, which is a CDC grant, which allows Rhode Island to share its data in a pool with all of the other states in a CDC database so that analysis, maps, and charts can be done on that data. We focus on the protection of children, workers, as well as the general public by identifying and decreasing environmental hazards within Rhode Island. We have about 20 full-time employees. Our budget is about $4.4 million. This is a combination of general revenue from the state, federal grants, Medicaid funding, and some restricted funding that we have. We have explicit mandates from the state of Rhode Island law to control lead, asbestos, and radon. We have an implicit mandate to manage and help control the hazards related to occupational safety and climate. We currently have federal grants supporting lead, asbestos, radon, OSHA, and tracking, and soon we hope to have a climate-related grant as well. Going to hand this over now to Michelle, who is the program manager for our lead poisoning prevention and environmental lead program. And so as each program manager starts, please introduce yourself. And I will keep time and let you know when you're at time.
Hi, Mike. Who's controlling the slides, you or Jennifer?
I am. So just say when you would like me to advance to the next slide.
Okay, so as everyone on this call is aware, we have there's 3 legs to the Childhood Lead Poisoning Prevention Program. We have the Childhood Lead Level Surveillance, which is funded by CDC. We have environmental lead, which is funded by EPA, and we have lead hazard mitigation, which is funded by HRC. Move to the next slide, please. So much of what gives us authority is through regulation and laws in the state of Rhode Island. So we have the Lead Poisoning Prevention Act, which is part of the Rhode Island general law. We have our regulations, which are established through the Department of Health. And many of you all on this call have contributed to the creation of these regulations, as well as keeping them up to date. And we have authority to enact the lead hazard mitigation regulations through an MOU. Next slide, please. So we have the main goals are to ensure that children under the age of 6 are screened for lead poisoning. We collect that data for the evaluation of screening and trends. We refer all children with blood levels greater than or equal to 5 to case management, as well as environmental lead inspections. As you all have seen in a recent email, we did adopt the 3.5 level that the CDC recommended. Those children at the current time will not be receiving case management or environmental lead inspections for the level of 3.5 to 4. 4.9, I'm sorry, but they will be getting follow-up screening from their primary care provider, as well as a packet will be mailed from the Department of Health. Next slide, please. So we offer the comprehensive environmental lead inspections for children who have blood levels at the current time of greater than or equal to 10 micrograms per deciliter. We also offer lead hazard mitigation inspections to children with blood levels of 5 to 9. We partner with many other departments within the Department of Health, as well as agencies throughout the state of Rhode Island. We do set the parameters for licensing lead professionals to ensure lead safe work practices are being followed. We conduct the field inspections, both compliance and complaint. So we will go out if a complaint's received from the general public, but we also monitor start works that come in, and we do enforce under the laws of our regulations and the general law. Next slide, please. And I'm sorry, I just realized I was off camera. So in order to promote the lead hazard mitigation program, we must improve the awareness of what lead hazards are and reduce hazards in Rhode Island. We must educate the landlords of their legal obligations and motivate them to remediate them. We are going through enforcement through doing the lead hazard mitigation inspections, as well as partnering with the cities and towns with the end goal of increasing the number of rental properties with certificates of lead conformance. All of this goes to the end goal of decreasing lead poisoning in the state of Rhode Island. Next slide, please.
All right, thank you, Michelle. Bonnie?
Good morning. My name is Bonnie Cassani Brandt. I'm the Asbestos Program Manager. Next, please. So in Rhode Island, the Asbestos Abatement Act, which is a law, is the enabling statute for our rules and regulations for lead poison. For the rules and regulations for asbestos control. And these regulations set minimum standards for asbestos control, provide for the training and licensing of asbestos professionals, and establish criteria for asbestos inspections and submission of abatement plans, and other requirements related to the safe abatement of asbestos hazards. There's also federal laws that we work under. One is called NESHAP. It's the National Emission Standards for Hazardous Air Pollution. It's part of the Code of Federal Regulations managed by the EPA. Our industrial hygienists conduct approximately 180 NESHAP inspections of asbestos abatement projects under a cooperative agreement with the Department of Environmental Management. The NESHAP funds come through the Clean Air Act, and DEM has that grant, and so they funnel some money to us to assist them with these inspections. It specifies the work practices for asbestos to be followed during demolitions and renovations designed to minimize the release of asbestos fibers. The other federal regulation that we work under is the Asbestos Hazardous Emergency Response Act, or AHERA, and these apply to schools. And it's funded through the Toxic Substances Control Act, and EPA directly funds our office for those activities. Under AHERA, we establish requirements for public school districts and nonprofit schools for inspections of asbestos-containing materials, asbestos management plans, and notification and custodial training, staff training. The Asbestos Control Program, industrial hygienists also perform 40 AHERA inspections each year. Next, please. So exposure to asbestos fibers may cause several illnesses, including asbestosis, mesothelioma, and lung cancer. These diseases are very serious. Mesothelioma is always fatal. There are treatments, but not all of them are curable. Again, the program is funded primarily by the Environmental Protection Agency, and it consists of 2 industrial hygienists and 1 program manager, myself, and we all also work for the Radon Program. Next, please. So some of the things we do are we certify and license asbestos training courses, analytical labs, consultants, competent persons, abatement contractors, site supervisors, and workers. We also conduct audits of the certified training courses. We develop procedures to ensure that abatement activities are performed in a safe manner. We perform technical reviews of asbestos abatement and management plans. We conduct NESHAP inspections and AHERA inspections. We provide technical assistance to the regulated community and other state and municipal agencies. We also investigate complaints. Next, please. So here's a little flow chart of how the NESHAP process works. The field inspectors go out with a checklist during the inspection. They complete it on site. They come back to the office. The information is entered into our database, and that generates either a compliance letter if no violations are identified, or a violation report if violations are found. And then these violations can result in a number of enforcement responses, including warning letters, notices of noncompliance, hearings, fines, and/or action against the violator's license. And the industrial hygienist who did the inspection will follow up as necessary. Next, please. So again, I'm Bonnie Casani Brandt. I'm also the Radon Control Program Manager. And here's a little slide that shows some data about radon in Rhode Island. And in Rhode Island, 1 in 4 homes has a high level of radon, predominantly in the southern part of the state, but you can have elevated levels all throughout the state, as we'll talk about in a few minutes. Nationally, it's about 1 in 15 homes contains high levels of radon, but in Rhode Island, it's much higher, 1 out of 4. Next, please. So in Rhode Island, again, we have a statute, the Radon Control Act, which enables our rules and regulations for radon control. These regulations establish standards for radon mitigation, provides for training and licensing of radon professionals, and establishes the protocols for radon testing and reporting. It also involves education and outreach by our office, and it incorporates the American National Standards Institute radon standards by reference. EPA now relies on some voluntary consensus standards by outside organizations rather than developing and reviewing them periodically themselves any longer. Next, please. So the Radon Program, again, is funded by the EPA. We have a one-time additional multi-purpose grant, which we're doing a special pilot project with. And we have the same 2 industrial hygienists and 1 program manager, myself, who also work with the asbestos program. Radon is an odorless, colorless, hazardous gas that can cause lung cancer. It's the second leading cause of lung cancer in the United States. The first is smoking. And it comes from the natural decay of uranium found in soil, rocks, and water, and can be harmful when it seeps into homes and other buildings. So the one-time multi-purpose grant, we're doing a pilot program with the Providence Lead Safe Homes Program. And what that program is a HUD-funded program for income-qualified properties where at least one child under 6 resides, to have all the lead hazards fixed through a forgivable loan grant program. They have additional healthy homes funds, and they've agreed to allow us, so our industrial hygienists who are trained and licensed as radon inspectors, actually do the testing. And if elevated levels are found, the city will arrange for a licensed radon contractor to do the mitigation. And then as part of our normal course of business, we do compliance inspections of those mitigation system installations. And we also do post-mitigation testing to make sure the system is working correctly. And to date, we've tested 49 homes in Providence, and 4 have had elevated levels above the EPA action level of 4 picocuries per liter. Next, please. So what we do is we implement and enforce the mandatory radon testing and mitigation requirements for high priority buildings. Those include schools, child care facilities, and public buildings. We certify and license analytical labs, testing businesses, inspectors, mitigation contractors, supervisors, and workers. We promote radon testing and mitigation in residential properties through education and outreach campaign. There's not a statutory mandate for radon testing or mitigation in residential properties. However, there is a real estate notification disclosure where the realtor has to inform the buyer that radon is found in Rhode Island. Testing is recommended. We promote radon-resistant new construction in homes, schools, and public buildings. There is a way to design a building and install either a passive system that can later be made active if elevated levels are detected, or it can be easily installed without altering the business of the building. So things they can do is like put in a pipe chase or put in a pipe, and then if they need it, it's there. And it's very cost effective to do it that way than do it after the fact. We manage and maintain a comprehensive radon database of high priority buildings and residential test results. And you can see a map that shows this on our website. And we collaborate with and support EPA with their initiatives. Thank you.
Thank you, Bonnie. Mike?
Hello, everyone. My name is Mike DeLuca. I'm the OSHA Consultation Program Manager, and I can be reached at michael.deluca@health.ri.gov. Next slide, please. Consultation Program is a free and confidential collaborative safety and health consultation to small and medium-sized businesses. The program is federally funded by the Occupational Safety and Health Administration, OSHA, and we have 5 OSHA-trained industrial hygienists. Consultations can be partial or comprehensive. They can be beyond minimal OSHA requirements, and their focus is on small businesses fewer than 250 employees at a single site or 500 corporate-wide. Next slide, please. Benefits for the employers. Consultation Program protects businesses from costs related to lost productivity, injury claims, fines, penalties, and citations. They protect employees from injury, illness, and lost workdays, increase productivity, and create an engaging workforce. And they're in compliance with federal OSHA safety and health requirements by eliminating or reducing potential hazards. Next slide, please. How the program works. An industrial hygienist will conduct a consultation. They'll help to establish, strengthen, and cultivate a safety and health program within the business. And they'll provide technical support, training in hazard recognition, and identifying resources for further assistance. A consultation consists of an on-site initial opening conference with business and stakeholders, an on-site walkthrough helping to identify hazards, either partial or comprehensive, as requested by the business, and an on-site closing conference discussing the hazards identified. There'll also be an inclusive written report at the end identifying hazards and offering solutions to mitigate future problems. Thank you.
Thank you, Mike. Caroline?
Thanks, Mike. So Rachel, who's the Climate Change and Health Program Manager, is out of the office, so she's not able to make this meeting. I'm Caroline Hoffman, and I lead communications for environmental health. So I work really closely with Rachel on the Climate Change Communications Program, and I'm filling in for her today. The Climate Change Program works to reduce climate change's negative health impacts, to promote health equity through policy change, public engagement, and education, and support communities to build resilience and capacity. Next slide. And before I get into a lot of the details on the program, I just wanted to cover quickly why climate change is a public health issue. So climate change brings more frequent and severe air pollution and allergens. It causes an increase in severe weather and extreme heat and rising sea levels. And each of these impacts has a direct effect on human health. For example, worsening allergens and air pollutants contribute to asthma and allergies. Extreme heat causes heat-related illness and death, and severe weather can lead to injuries and fatalities. And the human health effects of climate change are broad and varied and have both immediate and long-term impacts. And climate change really acts as a risk multiplier, meaning vulnerable populations face a greater impact from its effects. So we really focus on creating a healthy, sustainable, and resilient future for all Rhode Islanders. So the Climate Change Program focuses on education, advocacy, programming, and collaboration with the goal of reaching and empowering our most vulnerable populations. And the program frequently works directly with the health equity zones, representing geographic areas that have some of the highest burdens. We also work to identify specific populations that have a higher susceptibility to the impacts of climate change. For example, we've worked with older adults living in senior centers who have unique resiliency needs. Extreme heat is one climate change impact area of focus for the program. We tend to think of heat as a nuisance, but it can actually be life-threatening, and certain populations are more at risk based on factors like their age or certain medical conditions or prescription medicines or the type of work that they do. So outdoor workers are more exposed to extreme heat and they have unique communications needs. They don't identify with the older population that are typically presented as more vulnerable to heat. So RIDOH researched and developed the Beat the Heat campaign to reach this population and encourage actions to prevent heat-related illness. Also, because the urban heat island effect, some neighborhoods in a city are much hotter than others. And in the summer of 2020, the program conducted a heat mapping study in Providence, East Providence, Central Falls, and Pawtucket to understand which areas are hotter and which areas stay hotter overnight. And you can see the cover sheet from the report of this study on the slide. Cooler nights allow the body to recover from the physical stress of heat. However, if an area doesn't sufficiently cool at night, the body is deprived from this recovery period and experiences cumulative stress from heat. And this can make a person more at risk of heat-related illness. So in our study, we found that some locations within the study area are up to 12 degrees hotter than other locations at the same time of day, meaning some of our neighbors experience significantly hotter temperatures. And these findings identify areas with the greatest exposure and need and allow us to prioritize areas for future programming and services. Next slide. And the 2021 Act on Climate set mandatory enforceable climate emissions reduction goals, leading the state to achieve net zero emissions economy-wide by 2050. This legislation updates the previous 2014 Resilient Rhode Island Act. And the Executive Climate Change Coordinating Council is made up of members from a number of relevant state agencies and includes the RIDOH Climate Change Program Manager. So Rachel attends those meetings and participates in the council. The council implements the Act on Climate and is currently working to deliver an update to the 2016 Greenhouse Gas Emissions Reduction Plan by the end of the year. The council is currently soliciting public comments and hosting stakeholder discussions to inform the plan. Thanks, Mike.
Oh, thank you, Caroline. Peter?
Good morning. My name is Peter DePippo. I'm the Principal Investigator and Program Manager for the Environmental Public Health Tracking Network. The Environmental Tracking Network is funded by CDC through a 5-year cooperative agreement. And we're an interdisciplinary team that covers subject matter experts in environmental science and content, informatics, visualization of data, and geographic information systems, communications, and evaluation of all of our results. Next slide, please. So what does the Environmental Public Health Network track? We track environmental hazard, population exposures, and public health effects. And then our goal is to create public health actions that are implemented and to be able to evaluate those public health actions. We're one of 25 states and one city funded by the CDC, and we currently support in whole or in part 10 Rhode Island Department of Health employees, again, including data analysts, subject matter experts, and communications and web staff. Fundamentally, we collect questions. We look for the data that might answer those questions. We find the data that we actually have, which feeds back into our questions, and then we reevaluate and continue. This is as much a network of people as it is of software and systems. Next slide. So the tracking network tracks data from the environment, from population health, and from health effects. Again, we operate on every floor within the department and within the state health laboratory as I said, an interdisciplinary team of experts. Most importantly, I think we focus on the fact that your zip code is more determinant of your health than your genetic code. And we work towards creating precision public health actions. And so more importantly than all the work that we do is we make sure that it can be communicated to public health professionals and decision makers so that they can take the public health actions that we generate and put them to good use. At the end of the day, our data represents lives, and our goal is to save lives and improve the public health of the citizens of the state. Thank you.
Okay, thank you, Peter. Joey, go ahead.
Good morning, everybody. My name is Joseph Maya Rodriguez. I am data analyst 2 and the lead for the data team here in the Center for Healthy Homes. Our data team I have 3 members, myself, Kerry McCarty Proud, or data analyst 1, who collects, track, analyze, and visualize data from different programs here in the Center for Healthy Homes, and Andrew Vitaliano, or Senior Human Service and Policy and Systems Specialist, who is the administrator for the third-party vendor for food inspection software and help us with primary IT issues for the Center for Food Protection and for the Center for Healthy Homes. Basically, the data team, we provide all type of data expertise for all the different programs and grants under the Center for Healthy Homes. Plus, we provide support to other centers here in the Department of Health. We provide data expertise in data collection system, administration of databases, creation of dashboard, and the application of automatization process. One of the key works that we do every day is how we manage data and present data in the most easy way that people can understand it and access to them. Next slide. One of the best examples for the work that we do is the data dashboard. We develop series of dashboard using Power BI and another software with the intention to help the public to access the data that we have available in our data set and different indicators of health issues or environmental hazard. This example is from the Search Rhode Island property evaluation. This dashboard is open for everybody in the public in our webpage, and you guys can enter to see if your property have any certificate or any public violation, right? In the same time, this type of software dashboard you can enter to look for lead professionals in case that you want to hire somebody or want to validate some information from some lead professional. This is not the only type of work that we do. We are working more in what is automatization process around the department. Next slide, please. Using software like Power Automate, we are able to build different process that lets us to collect data from the public and bring it to our team and provide better service. This workflow sample can show you a little of the day-to-day work that we do. Here in this screenshot, you can see how we create a Word form that collect information from the public, organize the data inside for us to storage the raw data, plus create tasks for us so our team can communicate and work around. We create automatization process and we bring innovation in technology. This innovation in technology can help us to manage our day-to-day work, to tracking our performance, and to bring more efficient ways to help you guys. We've been able to bring automatization process that normally normal process that take days, now we can do it in seconds. And that's part of our day-to-day work and our day-to-day uh, goal for you guys is how we can use all the data and technology in our hands to make you guys life better. And the other part that we have is the visualizations of data uh, in the department. Next slide, please. Normally, our data team have different members that working in the visualization of data that bring different representation to the public that help people to understand what we do, right? One stuff is tell all the day-to-day work that we do by regulation and what we need to do. And another part is to see how these impact our day-to-day life, or part of our work is to create visualization that you guys can see how our work impact the community and find more information about what we do, right? This is a sample of one of the internal visualization that we do for stream events, right? And see how we can tracking. We use charts, we use data tables, we can build maps for tracking information, and we build this every day. Our main goal again is use everything that we have to make our life better and help and support everybody in the Center for Healthy Homes with any data issue. Thank you.
Thank you, Joey. So this is my name and contact information, and anything forwarded to me that require the expertise of any of the program managers, I'd be happy to forward on. So I'm going to stop presenting and thank all the program managers for their presentation. And thank you for the rest of the Healthy Home staff for participating, as well as the rest of the Public Health 101 scholars, new employees, and other participants. So Jen, we are open to questions with the remaining time, since we did do some good time scheduling. We can either go with raised hands or the chat. If you want to help me monitor the chat or read them out, we can also go with any, raised hands. I'll let you help us determine how you'd like to organize that.
Yeah, sure. Right now there's nothing in the chat. If anyone wants to unmute themselves to ask a question or raise their hand, we can call on you. All right, I'm not seeing any questions. I want to thank you all so much for joining us and sharing the great work that you do for the state of Rhode Island. And this has been recorded, so there will be future students coming in who will be able to view these. So it'll be great for them to have this as a resource.
Okay. All right. So, do you need anything else from us, Jen, or?
You are good to go. Thank you
All
so
right.
much.
All right, well, thank you,
Right.
Jen, and thank you everyone from Healthy Homes for participating. I really appreciate it. Thank you.
Thanks, Jen. Thanks, Mike.
Yeah.